Hey, my name is Emmanuel with Sandstone Care, and in this video, I'm going to be talking to you about the difference between substance abuse and addiction. The terms substance abuse and addiction are often used in very similar ways, which can actually make it very confusing for people to tell the difference. It is important to understand and recognize the differences so a person can get the help and proper treatment that they need. If you or a loved one are facing challenges with substance abuse or addiction, reach out for help and support. Sandstone Care does provide age-specific and individualized treatment plan for teens, young adults, and adults with mental health and substance use disorders. So if you are looking to get connected, I'll share more about that at the end of this video. Let's jump into it. So what exactly is addiction? Addiction is defined by the National Institute on Drug Abuse as a chronic relapsing disorder that can be characterized by compulsive drug seeking and use despite the negative consequences. When a person first begins to use drugs, it is often a choice. However, with continued use, a person loses their ability to exert self-control. Addiction is considered a brain disorder because it causes functional changes to brain circuits that play a huge role in reward, stress, and again, self-control. Addiction can have serious harmful effects on a person's life and health. Thankfully, these effects are often preventable and treatable, but if left untreated, the effects of addiction can last a lifetime and again become life-threatening. This is one of the very reasons it is so important to reach out for help and get proper treatment, whether it's for substance abuse or addiction. While addiction can look very different from person to person, there are some common signs and symptoms. Some common signs for drug addiction can include the following: developing a drug tolerance, experiencing withdrawal symptoms if drug use stops, being unable to stop drug use despite wanting to, spending a significant amount of time thinking about obtaining and using substances, facing relationship problems, changes in sleeping habits, your appetite and appearance, mixing drugs with alcohol, borrowing or stealing money to obtain drugs, abusing prescriptions to get more drugs, and lastly, mood changes and a lack of interest and motivation in things one's loved. If someone is exhibiting these signs and symptoms of drug addiction, it is best to educate yourself, talk about it, and then connect with professional help. Not everyone who abuses substances will develop an addiction, but recognizing the signs of substance abuse can get a person help before the abuse progresses into an addiction. To help break this down even further, let's discuss the differences between substance abuse and addiction. Abusing substances involves overusing a substance or using it in a way that it was not intended to be used. Addiction, on the other hand, can be characterized by uncontrollable drug use. So with substance abuse, a person can find it relatively easier to stop using a substance compared to trying to stop when you had become addicted. Substance abuse can be present without addiction. However, it is not uncommon for substance abuse to lead to addiction. The last difference I want to point out between the two is that substance abuse treatment often requires less intensive treatment, while addiction treatment, on the other hand, typically requires ongoing treatment. Substance abuse can involve overusing a substance or using it for reasons other than what it was intended for. This could happen when a person has been prescribed a painkiller and is taking higher doses than they were prescribed. Some people may also take medications that were never prescribed to them or use illegal drugs that they obtain from people that they know. So how can you recognize the signs of substance abuse? Here are some of the behavioral signs of substance abuse to look out for. The individual is regularly missing work, school, or other important events. They're isolating themselves from loved ones, experiencing mood changes and irritability. And lastly, being in denial of problems of drug use and neglecting their responsibility. Being able to recognize the signs of substance abuse and talking to the individual directly can help a person get the support that they may need. There are many treatment options for substance abuse and addiction available out there. Getting help for substance abuse can be a difficult and challenging step to take, but it is important to know that there is support for you. When substance abuse is left untreated, it is not long before its negative effects worsen and can potentially cause serious life-threatening damage. A great treatment program for substance abuse is again the one that works best for you. So it's important to take the time to research and consider all of your options. Psychotherapy, for example, which is also known as talk therapy, is often a part of substance abuse treatment. It can help a person understand how their thoughts, feelings, and behaviors are all connected. Psychotherapy, like cognitive behavioral therapy or dialectical behavior therapy, can also help a person learn healthy coping mechanisms and life skills. Overcoming substance abuse can be hard, but with help and support, a person can find healing both inside and out. I hope that this video helped you understand more about the differences between substance abuse and addiction. If you have more questions or are looking for more treatment options, you can contact us at sandstonecare.com or calling us using the number you see right down below. You don't have to struggle with substance abuse or addiction alone. Change is possible, and Sandstone Care is here to help.